Thank you very much for being here. All right, so I just have to ask you some supermarket questions. So people think, like when I go to the supermarket, people think that members of Congress should know everything, all right? So these are very simplest, but so one of the questions I get is if the coronavirus is just a cold symptoms, well, that's what we hear on the news.
No, flu.
Okay, more like the flu. Okay. So it's not just, I guess the question I have is, how long does it last? And what makes it so serious?
Okay. It isn't a common cold. The confusion is that about 10 to 30% of the common colds that you and I and everyone else get during a season happen to be a coronavirus. But a certain subset of coronaviruses can cause extremely serious disease. They did it with SARS, they did it with MERS, and now they're doing it here with the novel coronavirus. The reason it's serious is that a question that was asked by Dr. Harris is that the mortality of this is multiple times what seasonal flu is. So seasonal flu spreads widely. The mortality is 0.1%. Right now in China, the mortality for this particular infection is, the latest report was 3 to 4%. It might be a little bit less. It isn't a cold. It's very interesting that most of the common colds have upper respiratory infections. This virus, not to get too technical, the component of the virus that binds to a receptor in the body to allow it to infect, those receptors are rich in the lung. That's the problem. It binds to it. So a person can present no sneezing, no sinusitis, fever, shortness of breath. You do a chest x-ray and you have pulmonary infiltrates. That's not the common cold.
Okay. Well, thank you for that. I'll have a better answer for people. Next question, if you're able to comment on this, in terms of your research, is there anything that you think the FDA can do to speed up your research? I see a shaking of the heads by Dr. Collins.
You're referring to coronavirus?
Or any drug that you've been researching.
So we work very closely with the FDA. We actually have a joint leadership council.
Maybe that's a better question. Is there anything that we can do to speed up the FDA? Yeah.
Well, Tony, maybe you should say specifically with coronavirus, because FDA has been all hands on deck in that space and has been very recently pretty actively enhancing the ability to do laboratory tests.
I don't think there's anything that you could do to speed up the FDA. Quite frankly, they may need more resources to do the kinds of things they're doing. But we have, that's right, Madam Chair. But we have very good relationships with them. They have been very, very cooperative and collaborative with us in trying to get these countermeasures out as quickly as possible without cutting corners that would impact safety and our ability to evaluate efficacy.
Maybe the former acting commissioner of the FDA might want to answer this question as well, since he's now the head of the Cancer Institute. So, yeah, what could the Congress do to help the FDA there, Ned?
Yes. That's an interesting question. I'm here as NCI director today. I don't really want to speak on behalf of the FDA, a different federal agency. But I think, a challenge like this is really trying for the Food and Drug Administration because it's so sudden and the sort of machinery is built to be deliberative. I think probably the device center's decision-making about making these LDTs, the lab-developed tests, more widely available and releasing those restrictions is a really important development. That I think the academic labs will be able to bring these tests up to speed very quickly. I think they're definitely going to need more funding. I think they have some significant hiring challenges at the FDA that I worked on a lot. 21st Century Cures gave them a new hiring authority that was much appreciated, and I suspect they'll be using robustly. But they're really great people, and I'm sure they're up to the task.
I think I'm running out of time, so one more question on Alzheimer's. Is the private industry doing any research? Because I've always heard that because it's so expensive that they really are cutting back on that.
They are, but it's not all companies. Again, I have the privilege of serving as the co-chair of the executive committee of what's called the Accelerating Medicines Partnership, which is focused on Alzheimer's as well as rheumatoid arthritis, lupus, and diabetes. And there's 5 companies there that are invested in this in a big way. And they have been willing to put their funds as well as ours together into a partnership where all the results are open access. But it has been concerning that a number of other companies have ceased working on Alzheimer's disease because of so many clinical trial failures. We need them to come back. I mentioned earlier we have more than 50 new drug targets. We're trying to encourage them to get interested again.
Okay, thank you. I yield back. Thank you again for being here. This has been terrific. And so I have 3 questions. Okay, number 1 is, I had read a report or a study that women are feeling like doctors are dismissing their complaints. Number 1, I'm curious whether or not there's any research on sex discrimination in medicine. Number 2 is, where I live in West Palm Beach, it seems like in the entertainment district, every other storefront is selling CBD. Florida's also legalized marijuana, so I'm just curious whether or not there's any research to show that either CBD or the marijuana is medically effective. And then my third is back to my grocery store questions on coronavirus. I know you're not supposed to touch your face, but is it any part of your face, or where are the germs going? And if someone gets quarantined, how long do they have to be quarantined for? And can there be repeated quarantines? I mean, I guess the better question is, do you think this is going to be a widespread issue in our country? Sex discrimination first. Yeah.
Dr. Bianchi.
Certainly with regard to maternal mortality, there's definitely discrimination in that women's voices are not being heard. And that is one of the aspects of the Improve initiative that we want to address. That's the community-based initiative. We know that there is not only dismissal of women's voices, but also there's infrastructural racism. And we are definitely including that as part of this overall initiative.
Like CBD and marijuana.
We know that there is evidence from CBD to be effective for helping to treat seizure disorders in children, Dravet syndrome, and that has led to a medication. Otherwise, there are no other FDA products approved for CBD, but there is interest with respect to its analgesic effects. There is interest with respect to its anti-inflammatory effects. And we also definitively are interested and are evaluating its potential therapeutic value to help treat different types of addiction, including opioid addiction.
When you say interest, does that mean there's research being done, or
research is being done?
Okay.
We're funding researchers to do this, both in animals and in humans. And with respect to the THC, the information is more limited. There is some evidence that it could be beneficial for multiple sclerosis, for spasticity from multiple sclerosis, also for pain indications. And otherwise, the evidence is not very good in terms of its potential benefits. But researchers are doing studies, and we're funding researchers to do studies on PTSD, for example. Could it have a value?
All right, back to the coronavirus.
Yeah, touching your face.
So,
well, first of all, how do the germs get in you?
okay, so first of all, you asked a question about touching your face.
Yeah.
So the public health ways to avoid getting coronavirus are very similar to those to avoid influenza. And that is, particularly as simplistic as it sounds, washing your hands as frequently as you can. One of the problems with respiratory-borne diseases is that they are spread either by droplets, gross droplets, someone coughs or sneezes on you, or even a bit of aerosolized, where you can be sitting next to someone very closely and you don't cough and sneeze, but the virus can aerosolize and
So,
go.
I mean, does it go into you through your nose, your mouth?
That's what I'll get to.
Okay.
All right. So what it is, it will get in through a mucosal surface that could either be your nose, your mouth, or even your eye. The reason for washing your hands is that people often do the wrong thing. That's why you hear us say cough into the crook of your elbow, because people sometimes go like this or blow their nose. They'll shake hands with you, touch a doorknob, 15 minutes later, you come by and do that. Then you touch your face, and that's how you get it. So that's the way. That's the first thing. Secondly, incubation period, quarantine. The incubation period, the median time from when you get exposed to you get clinical symptoms is about 5.2 days. That's the median. The range is somewhere between 2 and 14. 14 is much, much more the outer limit. So when someone is suspected of being exposed, they either self-isolate or they get actually institutional quarantine for 4 days.
But you could have
14 days. 14.
Could you have multiple self-quarantines? I mean, what if you get exposed and then you stay home and then you get exposed again and you stay home? Do you have to stay home every time you get exposed?
Well, it depends on what you mean by exposed. I mean, if you are exposed to someone who has documented infection and then you are tested and you go into voluntary isolation, not necessarily quarantine.
Right.
The only time you get quarantined is if it's very, very clear that you have direct contact with someone.
But it could be multiple times.
Well, it could be if you're in a situation where you're in an outbreak. Well, that's very interesting because when you go from containment, which means to preventing the spread, to mitigation, which means in the community, distancing yourself socially. If I don't want to say when, because every time I say when, it's a headline. If it gets to the point where there is really widespread infection, if that ever happens.
Do you expect that to happen in our country?
I can't predict that. I cannot predict.
Are you worried about it?
I don't worry. I try and just do things that can prevent it.
Thank you very much. I yield back. Well, first, I just want to say I want to thank our chair and our ranking member and all our panelists. It is so refreshing, and I think we're blessed to be able to have a bipartisan discussion on health research, and very fortunate to have people of your caliber leading the way. I'm not going to ask you any more supermarket questions, but I just note that I touched my face so many times today that seriously, I'm very worried about the social and economic impacts of the potential of this virus. That's really very frightening, and I'm not going to get into it with you guys, so I'm going to ask you some different questions. Specifically, in Florida, and I also know in the nation that suicides are a big issue. And also, I saw something that it's a leading cause of maternal death. Is that right? That's suicide? No? Okay, I'm glad you're saying no. But I want to just combine these questions because I'm curious not only about suicide research, but also postpartum depression research.
I'll quickly start with suicide and then ask Dr. Bianchi about postpartum because that fits with our maternal mortality topic. Certainly suicides increasing in many different communities and demographic areas are of deep concern, and there are many diagnostics about why that might be going on that relates to people's sense of isolation, which is clearly a growing problem in this nation. We at NIH are aiming to do everything we can to identify the factors and particularly the predictors of who is at risk and what the interventions might be. And there's certainly some of those, such as trying to make sure that people don't have access to lethal force for that moment where somebody makes a sudden decision to end their life. And it's often a rather sudden decision. I will say also in terms of treating the clinical depression that often undergirds this, there is a major development that's happened, which is the development of this drug called ketamine, which has this remarkable phenomenon in many people who've had chronic clinical depression and not responded to anything else, of after an intravenous infusion having an almost within an hour lifting of the clouds. That is now being tried in people who are acutely suicidal and starting to look pretty promising in that space. If you can catch somebody before they take the drastic action and lift them out of what seems to be a hopeless circumstance. So that's one bright spot in what is clearly a very tough problem.
Yeah, so NICHD is funding research that it currently is looking at postpartum women who potentially are at risk for suicide. So the difficulty with the postpartum situation is some of these women have no prior history of mental health problems. So how do you, again, it's this rare issue where how do you know if someone is going to be at risk? So we're funding an investigator who is actually looking and taking a machine learning approach through the electronic health record to begin to identify certain clues in the record. But the other issue is a lot of pregnant women are depressed and they're taking antidepressants during pregnancy. So we need to know, are these drugs safe to take during pregnancy and lactation? And there's an area where I'm concerned because women who are at risk are not taking their medicines because they think it's better for the baby. And so we are doing research to show what is safe and what isn't safe. And we have a study called the Cuddle Study where women taking these medicines are donating their breast milk so that we can see what is actually in the breast milk.
Thank you very much.